Welcome to the Slop Temple. We pray this video helps.
You start by ensuring the problem is real. Get a home sleep test or lab PSG if you haven't. Once confirmed, prioritize quick wins. Raise your head 30 degrees with a wedge pillow and test side sleeping immediately. This reduces airway collapse by changing gravity vectors. At the same time, begin a realistic weight plan to lose 5 to 10% of body mass because less neck fat lowers obstruction. Make sure to track symptoms nightly and log snoring, gasps, and daytime sleepiness. Now you move into the hands-on treatment. Fit a mandibular advancement device or tongue-stabilizing device and wear it every sleep period to mechanically open the airway. In parallel, commit to oropharyngeal exercises for 15 minutes a day to strengthen the tongue and soft palate. This changes tissue behavior over weeks. Use a pulse oximeter at night to monitor oxygen dips and titrate device or technique if nocturnal drops persist. Once done, compare logs to baseline to measure tangible improvement. Finish the program by optimizing fit and addressing remaining contributors. You should tweak the oral device until jaw discomfort stops and breathing events fall. If pain or persistent apneas continue, visit a dental sleep specialist. Treat nasal obstruction with saline rinses, topical steroid spray, or external dilators because nasal flow reduces mouth breathing and apnea severity. If you followed steps for 3 months with minimal improvement, make sure to consult a sleep specialist for further testing and
Thanks for watching. Consider subscribing if we helped you.